Hello and welcome to the Pharmacy Informatics Professor 2020 with your host Armin Simonian. In today's 7th episode, I would like to jump right into a discussion of electronic health records, one of the more important topics in the area of pharmacy informatics. In one of our previous episodes where I talked about computer basics and data structures, we talked about our electronic health record systems as being very large database systems. And here's some of the definitions that I had run through in the previous episode. Here's a very simple definition of electronic health records. And we see here that we're pulling in information from the patient's medical record and also their personal health records, things that we might find on their smart devices, and that data is also pulled in. And we also want to pull in information from our providers' systems, our physicians, and whatever information is gathered in the primary care office or clinic setting. So in the beginning, let me go back, we had paper charts. And everything, including results, documentation, was on paper. And then we started seeing hospital systems come into place. These were very simple, mostly financially oriented systems where we could charge for medications, charge for labs that were ordered, and it was really not clinical, but financially based. Then we started seeing proliferation of departmental systems such as pharmacy, laboratory, and radiology. And then we saw the integration of these into the hospital systems, and that's where we started seeing a more clinical focus to our electronic health records. I had talked before about the continuum from data to information to knowledge to wisdom. And here, with this move to the clinical side, from the financial side, we see knowledge that also has to be incorporated so that our systems can provide clinical decision support. On the NAPLEX, you will get cases, clinical cases, and you'll be asked to evaluate a patient and recommend therapy or look at issues with their therapy. And this information is going to be pulled in from basically an electronic health record. So they'll give you a history of a patient, they'll list their allergies and their current medications and probably some lab results, and then ask you a question about what the appropriate therapy might be. And so you have to focus in on allergies and make sure that you're avoiding drug-drug interactions, and then also know the current guidelines to know what medication to prescribe next. So within our systems, these more clinical systems, our electronic health records, you'll see a lot of documentation, things that you'll find in a progress note or SOAP note, history, problems, diagnoses, allergies, home meds, results, vital signs, notes. Remember, pharmacists do write progress notes. We also are asked to do consults, aminoglycosides per pharmacy, and we have to document what we're doing and write orders. And also, we often do unsolicited interventions when we found an issue with a particular order. We want to document what we did with that. Another important documentation within the electronic health record is the electronic medication administration record, the MAR or EMAR. And this is where after medication is given to the patient, administered, this document is being given. This is really important. Going back to the example of aminoglycosides per pharmacy, if you're doing gent dosing and you need to take a trough 30 minutes before the next dose is given, and then take a blood level 30 minutes after the end of the infusion, then you want to look at the MAR to make sure that that was done properly, that the dose was timed properly in terms of when the next dose was given, and also the blood draw, and then you can do your pharmacokinetics. HIMSS has an EMR adoption model called MRAM, the EMR adoption model, and here we talk about 7 stages, kind of a certification of electronic health records. we're all trying to get to stage 7. And you see at the bottom here are the systems that I mentioned that we started with departmental systems, lab, radiology, and pharmacy. And then as you move up the ladder, you incorporate clinical decision support. And when you have a fully integrated system that pulls in data from all different sources, then you eventually reach level 7 or stage 7. Let's talk a little bit about national legislation. So over the past 20 years, the federal government really has been trying to promote the use of electronic health records. And it started way back in 1996 with HIPAA. Now, when we talk about HIPAA, we usually think about data privacy and security, but what people don't realize is the government really wanted us to get off of paper systems, and when we billed the government for Medicare services, they wanted that to be electronic. In order to do that, we had to prove that we could keep patients' information safe and secure, but also we needed to have coding in place. We need to identify employers, providers, and health plans, and be able to track transactions as they occurred, and then also have code sets for diagnoses, medications, and other things. So you'll see this kind of standardization that I talked about previously with interface standards and code standards for diagnoses and meds and other areas coming into play here. So this was all part of HIPAA originally. And then we move on in 2009 to the ARRA, the American Recovery and Reinvestment Act. After the financial collapse in 2008, we were trying to get the economy going again. And part of that was the HITECH Act, in which we tried to promote, the federal government tried to promote the further use of electronic health records. And they actually provided an incentive at that point called meaningful use. So they said that if you implement your electronic health records, and this applied to hospitals, clinics, physicians' offices, then the government would reimburse you with an incentive so that we could offset some of those costs of implementing those electronic health records. But it had to be done in a meaningful way, and they had standards that you had to meet to show that you were implementing your electronic health records meaningfully. So we started with HIPAA, and then we ended up with the HITECH Act and meaningful use. And really, this started the golden age for pharmacy informatics, because at that point, every hospital in the country really was interested in having experts, the pharmacy informaticists, the clinical or nursing informaticists, the physician informaticists on the team to help implement electronic health records in a meaningful way. So this really expanded the role of the pharmacy informaticist. Let's do a case study about electronic health records, and I want to talk about a male patient who has diabetes, blood sugars are under control, allergic to penicillin, and this person decides to go and have dinner with friends out of town at a restaurant with some outdoor seating. And then after dinner, while walking around, the patient falls, slips and falls, hits his head, and is knocked out. The paramedics are called, and they take him to a local hospital. Now, if we look at this patient's electronic health records, their medical data, we see that blood glucose results were recorded on an iPhone app. The student health service, where the patient got their influenza vaccine, uses a different system called point and click. And the physician's office has an EMR, EHR system called Nextech. And where the patient is assigned at home, at their medical center, they use the Meditech EHR. And at this visiting health center where there was a slip and fall and the patient was taken to the emergency department, they use Cerner. So you see the challenge here. The patient has all kinds of health records, medical records that are disparate across many systems. And the challenge is pulling all of that together into one spot so that when the patient is taken to a visiting health center, they can go into the Cerner system and really pull in information from other systems. So we talk about health information exchange, and this was on a graphic that I had on the previous session where I started talking about electronic health records and interoperability. So our goal is, no matter where you are and where you might have a medical emergency, wherever they take you and whatever computer system they use, the primary care provider should be able to call up all of your information and be able to treat you properly on the spot without having to ask questions of you or your friends or loved ones and trying to recreate diagnoses, allergies, and all of that good information that's already out there into the visiting health center system. Remember, as a pharmacy informaticist, once we have electronic health records and all this great information in one spot, and everybody's relying on those electronic health records to take care of the patient, there will be downtimes. You have to be able to plan on downtimes. There are two types of downtimes. They're either planned or events that are scheduled, such as updates, upgrades, and maintenance. And then a lot of times you can have unplanned downtimes, which can be a disaster, power failures, or other problems. And so remember, as a pharmacy informaticist, you not only want to create good systems, but you want to also have backups in place and alternatives if the system goes down. So the top EMR or EHR vendors, Epic, Cerner, and Meditech, these are screenshots, old screenshots from their systems, but it gives you an idea of what the electronic health record looks like. You only have a certain amount of real estate on each screen. You have a navigation bar off to the side typically, and on the other side here you see another kind of navigation bar, and this gives you basic information about the patient and then allows you to jump to the screen that you need to go to look at more information. You see all three of these top systems kind of have similar layouts. I hope this was useful for you for introducing electronic health records and getting into some of the details of what's contained in them and how they're built. And if you found this useful, please like the video and subscribe to my channel, and I'll thank you for that. In the meantime, stay safe, stay healthy, look after the health of others, and we'll see you next time. Take care.